Hi, my name's Emily Mendez, and as you all know, today is National NASH Day, and I am going to be discussing NAFLD and NASH and kind of helping you to understand a little bit of what NAFLD and NASH mean. Okay, so I'm going to be going over what is NAFLD, what is NASH, and what causes fatty liver, and what complications arise from having fatty liver, and what are some of the actions that we can take to get our liver back to healthy. Non-alcoholic fatty liver disease is a buildup of extra fat in the liver cells. It is not caused by alcohol. It is normal to have some kind of fat in the liver. When we start to say that you have fatty liver, it's because the weight of your liver tends to be 5 to 10% greater. So we call this fatty liver, also known as steatosis. 1 in 3 adults has fatty liver disease. Now, what is NASH? The more severe form of NAFLD is called non-alcoholic steatohepatitis, which is NASH. Hepatitis in this case means inflammation in the liver. NASH causes the liver to swell and become damaged. Inflammation and liver cell damage can cause fibrosis or scarring of the liver. Fibrosis, as we know, the more fibrosis we get in the liver, it can cause you to go into having a cirrhotic liver. A diet rich in fat and what causes fatty liver? A diet rich in fat and sugar, overweight or obesity, being diabetic, having high blood sugar, being told that you're pre-diabetic, having high cholesterol, high triglycerides. Those are some of the indications that that you are in that area of having fatty liver. You can have it checked by doing an MRI, ultrasound, or a fiber scan. These can be tools to use to help as indicators to help diagnose if you have fatty liver disease. Some people may have it because it's a genetic inheritance. Of course, obesity. It may be caused by a side effect of medications. You also can get fatty liver by rapid weight loss. Now, some people may see someone who is thin and may not even know that they have fatty liver. I've had some people come in and they do have fatty liver disease, and some may even have NASH. Of course, fats in the blood. Having high triglycerides, high cholesterol, those are all indicators. So if you know you have history of that, it's it's good to have that checked. Diabetes, patients that are diabetic also fall into the category of being in the risk of having fatty liver. Some of the complications that can arise from having NAFLD or NASH is having cirrhosis, which is a late stage of scarring in the liver, and that's due to having a severe amount of damage to the liver over a prolonged period of time. So what happens when you have cirrhosis, you've done a lot of damage to the liver, causing the liver to pretty much start to die. And when you are at the NASH stage, you have inflammation, and it starts at a very small rate. The more you ignore it, you have the risk of it becoming more severe. So fibrosis spreads to take up most of the liver, and more liver tissue will be damaged. So if you're in the NAFLD and NASH stage, just to let you know, it is reversible and you can, treat it by diet and exercise. Currently, there is no medication in the market right now, but we are doing a lot of clinical trials and working on getting these medications out in the market to help patients. Um, as everybody well knows, that the liver disease, fatty liver, is a silent, what they call a silent killer. So the reason they say that, because when patients find out that they have a liver disease, it can happen at a stage of when they've already developed cirrhosis. They start to notice that they have fluid buildup in the abdomen, which is called ascites. Swelling of the veins in your esophagus, it's called esophageal varices, which can rupture and bleed. And if this happens, then your doctor will schedule endoscopy and ban the varices. Um, so in patients tend to develop confusion, drowsiness, slurred vision. This is called hepatic encephalopathy, liver cancer. And then, of course, the very last thing of this is called end-stage liver failure, which means that your liver pretty much just has given up. So there are preventions to a healthier liver. Some of the things to reduce your chances of developing fatty liver or advancing to NAFLD is to watch what you're eating. Um, a lot of people that are in this category tend to be overweight or obese. They're eating a lot of high sugar beverages, eating a lot of high calorie foods and high sugar beverages, fast food, fried foods. They're eating late at night. They're pretty much excluding exercise and just doing all the things that we're not supposed to do. Things that we can do to make it, to get yourself to a healthier liver is like reducing your calories by at least 500 to 1,000 calories, reducing your weight by 5%. At least that's a beginning stage of where you can start to develop a healthier way of living, changing your lifestyle, um, eating, maybe taking a walk after you eat, eating more fruits and vegetables, your lean meats, fish, chicken, those kinds of things. You want to eliminate certain foods out of your diet as well, that have those properties of um, bringing you to having a fatty liver, which can be like your pastas, your rice, your flour, anything consisting of flour, potatoes. Those are all things that you may have grown up eating, and you're just like, oh, but of course, those are things that you want to do and change and become healthier, to have a healthy liver. And remember, it is a NAFLD and NASH are reversible, and you can, live a healthy life and have a healthy liver. That's all I have. If you have any questions, please feel free to chime in. Well, thank you again, and for more information, please call 210-949-0122. I finished. Yeah. That's crazy. I lost track of it.